Dismay, and welcome to the latest in our series of AI Med Talks, focusing on how data science is responding to the coronavirus pandemic. Today, I'm really pleased to be joined by a special guest, Hassan Chaudhury. AI Med regulars may well recognise Hassan, but for the benefit of those who have not come across you before, Hassan, perhaps you can just introduce yourself, please.
Thanks, Alexis. So I am the digital health specialist. I lead on digital health for the UK's Department for International Trade. I'm at a team called Healthcare UK, which is a joint initiative of the DIT, NHS England, and the Department of Health and Social Care.
Thanks, Hassan, and thanks so much for joining us today. As you know, through this series, we are seeking to highlight the use of data science and AI in managing, mitigating both present and future pandemics. What's your take on what's going on and the potential of data science and AI to respond to it?
I think there's a troubling paradigm where we are now in a situation of tragedy, but also of opportunity. And we don't want to sound callous, especially when there's so much human tragedy going on. But there is a time now, if we get this right, because we've passed the tipping point, we can't go back to non-digital health, non-data, non-AI. I think we've broken through a lot of the barriers, but we have to get it right. And there's two big obstacles to that. The first is that all of the buyers around the world, governments and ministries of health, are inundated and swamped with offers from tech firms. So they're not really hearing what's going on because there's too much noise. Very hard to discern what's really good out there. And the second, and I'm not the first to say this, there's a risk that we're going to push untested, unvalidated, untried tech because we're in a rush. And that's the wrong thing to do. And one of the most important things we can do is find trusted technology and push that faster. But what are we going to do? And I think right now there's going to be some junk tech thrown at us, things without evidence or poor evidence. And we're going to be faced with a choice. Do we take a risk because of the situation? Or do we stick to our principles when it comes to evidence and regulation and validation? And we're not alone in this. Same thing's happening with people who argue that we should do the same for privacy. And that's what's going to happen with surveillance. Are they going to stick to their principles, or are they going to take a risk?
Thanks, Hassan. And can you give us a little bit of a taste of the projects that you're working on in response to COVID-19 at the moment?
So very briefly, there's three things that I'm doing. One of them is that I'm part of a team that set up a forum called Tech for CV19. So some very good people had an idea that the UK health tech community shouldn't fragment, shouldn't become lots of different communities doing different things, pull in different directions. So they formed something on Slack, and this online forum has something like 750 members within the first 2 weeks. Innovators and suppliers and experts, also buyers, people who've got needs, and agencies like NHSX, and people like me from the DIT. And this group has put together a really interesting thing. Different companies can put their offers onto the forum. They can be validated, and then they can be put forward after they're segmented to government agencies. So that's open for everyone to join. The second is some people have set up a charity, some good people, and this charity is called Kit for Carers, because there's a real challenge around getting PPE, personal protective equipment, for people in the front line. And that's goggles and aprons and masks. And most importantly, I think for this call, we're doing something at the Department for International Trade, which is an offer around COVID-19, where companies from Britain can put forward their offer for COVID-19 on a non-profit basis. So something that is free or at cost recovery, because this isn't the time to be making a profit from such a tragedy. And the Department for International Trade will broker, matchmake, and try and get our companies into good positions to have these discussions with organizations around the world using our network of 109 British embassies, high commissions, and consulate generals around the world.
Three excellent initiatives there. Thanks, Hassan, for sharing. And I mean, you mentioned the work to put together a directory of UK-based businesses with a response to COVID-19. I'm pleased to say that AI Med are able to support with that, and we're really looking forward to having you join us for a webinar next Wednesday, the 22nd of April at 8 a.m. UK time. Just to wrap up, Hassan, for people who might be looking to register for that webinar next week, what would you hope they take away from their attendance?
Well, I'm hoping to give an idea, a flavour of the breadth of what we can do in digital health. It's not just about electronic patient records, although that is a very big deal. It's not just about saying, here's some data and there's an algorithm. There are lots of different things that we're solving in digital health. So we can go through some of the use cases and some of the British companies solving them. And I think if we give you some examples, then it will become much more real. And then we can see how digital health can support us during this crisis.
Brilliant. Thanks, Hassan. And we're really looking forward to the webinar. We'll be sharing more details as they come available. Thanks again, Hassan, for joining us today. And thanks to everybody for joining us. Please do make sure to share, like, subscribe these videos as we seek to spread the word about the great work being done to respond to this current crisis. And keep an eye out for more AI Med talks at ai-med.io.